Hello, everyone. My name is Wendy Myers. Welcome to the Myers Detox Podcast. And I started this podcast and I founded MyersDetox.com to educate everyone about the issues and dangers of heavy metal toxicity, where we get this stuff in our body, and how to detox them. I truly believe that heavy metals and toxins are the number one primary drivers of disease today, and I want to empower you to improve your life through the power of detox. Today we have Dr. Melina Robert on the show to talk about the pros and cons of IV chelation therapy. I get a lot of questions about this, so I wanted to finally do a show on it. And we're going to talk about what you need to consider before doing IV chelation. Is it right for you? Why IV chelation is not the answer for everyone, and people need to be careful. You go to a functional medical doctor. A lot of functional medical doctors are doing IV chelation and, doing some testing, see that you have some high heavy metal levels, and then kind of recommend it. It might be one of the only things that they do when it comes to detoxification, but it's not right for everyone, especially if you're very ill or you have compromised kidney function. You need to reconsider perhaps some gentler options before diving into that. Granted, every situation is different, but you really need to weigh the pros and cons. We talk about how many IV sessions do you really need, and we'll talk about the biggest pitfall when it comes to IV chelation. We'll discuss whether or not IV chelation really can do a deep detox of all of your body's heavy metals and toxins. We'll also get into the gallbladder, the key role in the gallbladder for detoxification. What kind of things contribute to poor gallbladder function? What diet and lifestyle issues are causing so much gallbladder issues today, and how to support healthy gallbladder function and bile flow, which is so key for detox. I know so many of you guys listening are concerned about your levels of heavy metals and toxins in your body. So I created a 2-minute quiz you can take at heavymetalsquiz.com that will help you discern your relative levels of toxins that you have in your body. And after you take the quiz, you get a free video series. It answers all of your frequently asked questions about how to detox your body, what testing is best, what supplements are good to take, how long does it take to detox, answers all these questions and more. So go take that at heavymetalsquiz.com. Our guest today, Dr. Melina Robert, is a naturopathic doctor and author of Building a Healthy Child and founder of Advanced Naturopathic Medical Center in Calgary, Canada. She is recognized as one of the top biological medicine practitioners in North America and is a lecturer for the Paracelsus Academy. And she is a leading authority in the field of naturopathic medicine, specializing in biological medicine, effectively treating digestive issues, chronic disease, and cancer. Dr. Roberts is a graduate of the University of Waterloo and the Canadian College of Naturopathic Medicine in Toronto. And she did a 2-year postgraduate study in biological medicine with Paracelsus Clinic in Switzerland. You can learn more about Dr. Roberts and her work at advancednaturopathic.com. Melina, thank you so much for coming on the show.
Thank you so much for having me. I'm excited to be here.
So why don't you tell us a little bit about yourself and, how you got into medicine and focusing on detox?
So I had a few different influences in terms of how I became a naturopathic doctor, but, one was personal experience in that I was a kid that had really bad allergies and eczema. And when I was about 13 years old, a family friend said to my parents, you should try taking her to see a naturopathic doctor. And, this was many years ago, and we had no idea what a naturopathic doctor was and if they could even help me or what they could do. And really so we went and saw this naturopathic doctor, and within a pretty short period of time, all of my allergies cleared up. And to me, it was like magic at that time because I had no idea how it all worked. But that made me first of all, realized that the body had that amazing ability to be able to heal itself. And then that also made me want to have that kind of effect on people's lives. So that made me want to become a naturopathic doctor as well. So I followed that route. And then when I was at the naturopathic college in my second year in school, my dad was actually diagnosed with pancreatic cancer, which was pretty challenging to me because my dad was my world. I was definitely a daddy's girl. And started doing tons of research and trying to figure out, how to treat cancer effectively. And I was coming across a whole bunch of amazing answers, but I really just needed more time. And unfortunately, my dad passed away 9 short months later. But that really started my road to really how to heal the body, how to treat cancer effectively at the root causes. And I started really making that the focus of my practice once I graduated, and just doing more research into it. And to me, a big part of treating cancer is healing the gut and making sure that pathways of detoxification are working optimally.
Yes. Yeah. Because that's one of the reasons people develop cancer is all this toxin buildup in their body, and their body can't exit, and starts causing wreaking havoc on all the body's different organ systems. And so one approach to heavy metal toxicity is IV chelation. And we're going to do a deep dive on this. So I get so many questions about this because, when you go to a naturopathic doctor or a medical doctor, typically you're, the option is usually IV chelation. And so let's talk about this. And what are the benefits of IV chelation? We'll get into the cons in a second, but what are the benefits?
With IV chelation, what we do is we are putting a chelating agent into a bag, really, and then giving that to a patient intravenously. And the benefit of the IV chelation is what it does is those chelating agents pull heavy metals from the tissues. They pull them into circulation. Then your body has to be able to detox them. So they'll move them out, typically through the kidneys, and then you will pee out those heavy metals. So it's a fast and effective way to move heavy metals out. But when we say fast and effective, sometimes patients can't handle fast
Especially if they're very ill.
Yeah, exactly. So you have to kind of gauge a patient to see where a patient's at, whether we do IV chelation.
Okay, great. And so what are some of the benefits of the IV chelation? So you said it fast, very effective. Any other benefits? I mean, for me personally, I think there's a time and a place. If you have a life-threatening heavy metal toxicity, we need to get that out really, really fast. What is your take on that?
Yeah, and well, it kind of depends on how much it's disturbing a patient's function. So, heavy metals we can basically be accumulating heavy metals over a lifetime. And that's a challenge, is that you might not notice that you are accumulating heavy metals over this period of time until it starts to affect the function of how your system's working. We are accumulating heavy metals from the environment that we live in, from the water that we're drinking, from the foods that we're eating. So unfortunately, as they accumulate, but what's happening is that those heavy metals will be going into different tissues in our body. And the challenge is that, in every person, they're going into different tissues, and depending on which tissues they're going into, they can be affecting how those different systems are functioning. So, for example, if we have heavy metals that are affecting, heavy metals have an affinity for our nervous system. So if we have heavy metals that are affecting the nervous system, then this can actually be affecting how that nervous system is functioning, and that can actually lead to a host of other problems. So we need to be working on getting those heavy metals out. So, for example, someone with like MS, so like a neurodegenerative disease, one of the underlying causes can be heavy metal toxicity. So it really depends on, which system it's affecting and how quickly we need to get those out. Or do we have enough time to be able to do it more gently, or do we need to be moving them out as quickly as possible?
So what are some of the chelators that are used when you're doing IV chelation?
So one of the main chelating agents that we use is EDTA. So we do a calcium disodium EDTA that we do via IV. Another chelating agent that we'll use is one called DMPS. And that's a common one that we'll typically do those ones both via IV. One that goes in the bag and one that we push after the IV. And the other thing that we do is that we put it into basically like a Myers cocktail IV. So it also
it's
has
my favorite cocktail.
Yes, well, it's named right after you. Yeah, so it also has some B vitamins. It has vitamin C. It has some minerals in there, but not too many because those minerals tend to be chelated out. But it also gives the body some support in terms of nutritional support as we do it. So we're not just sticking the chelating agent in just by itself. So that's those IV chelators. And then we do have some oral chelators that we will use sometimes as well, which would be the DMSA is the other one that we would use. But that one is typically done orally. And then we can sometimes do some gentle chelation for patients who, their kidneys aren't as strong and they can't handle the IV chelation. And so those ones we could do some gentle ones with using things like chlorella, some of those gentle ones that still transport heavy metals out of the body, but do it a bit more gently.
Okay, great. Yeah, and I've taken oral DMSA before. I've never actually done an IV chelating agent before.
Okay.
I didn't really need to. I just did it in other ways.
Yeah.
But there's certainly a time and a place. And so let's talk about problems with IV chelation therapy. What can go wrong, or what do people need to be aware of if they are presented with, they go to their doctor, they're told they need to detox, and they're given this as their only option. What should they be considering when it comes to IV chelation?
Yeah, and I think that that's a good question, because I think that a lot of people aren't aware of the risks when they're offered. They're just told about the benefits. We'll use IV chelation for a number of things, right? I was talking about the neurodegenerative problems, but it's also good for cardiovascular issues as well. But what we also need to realize is that there's risks involved in terms of IV chelation. And in terms of those IV chelation is that it can be challenging on the kidneys, because the body will move those heavy metals into circulation, and then the body has to actually be able to properly detox and move those metals out, typically through those kidneys. So if those kidneys aren't functioning optimally, then that can be a stressor on the kidneys. The other challenge is that as we bind onto those heavy metals, the body will, those chelating agents will also bind some of your minerals. So we got to make sure that if you're doing some IV chelation, that you are doing support for the kidneys and that you are remineralizing the patient, or else you're going to leave the patient deficient in minerals. So I think that, when you're speaking to a practitioner who's doing chelation, you need to be also asking them questions about, in this protocol, are we doing some kidney support? Is there some remineralization happening either through IVs or through oral supplements? Just to make sure that you do supportive therapy while you're doing that IV chelation.
What are your thoughts on practitioners that are doing both EDTA and DMSA at the same time? I've heard of them doing that before.
I think that, it's possible and safe to be able to be doing both at the same time, as long as you are, giving patients the right dose and not, I think that the challenge sometimes is that patients practitioners can sometimes push the patients too hard, right? Because I would say that, in general with IV chelation, we are doing it at most once a week, but in a lot of cases, we're actually doing it once every 3 weeks to just give the body some time to be able to move those metals out. And, I've heard of some patients telling me that they were seeing a practitioner and they were getting IV chelation, every day for 3 weeks. And those ones, I think that that's so hard on a patient without doing the proper support with the kidney support and the remineralization that if we go too aggressively with IV chelation, that it can be pretty challenging on a patient's system.
Yeah, I mean, I've definitely heard of people having kidney damage, and it's not worth it. It's not worth it if you're already ill or ill enough to warrant IV chelation, you want to take it really, really slow. It's not worth detox to permanently damage your kidneys.
Yeah. And we normally do a test on patients prior to doing IV chelation. So we do a test to see, first of all, what their kidney function is at. So we make sure that their kidneys are in a healthy range to be able to properly detoxify. And then we also do some testing to see what kind of levels a patient is at in terms of those heavy metals, because, just doing chelation, I'm sure most people, if we were to test them, have high amounts of heavy metals, but we want to make sure that we're using the right chelating agents with the patients and that their levels are in those high ranges, that they are problematic in their system.
Yes. And so when someone starts IV chelation, how many sessions would you normally do, maybe before you retest again?
So I will normally do, so that's a challenge too, is that you actually need to be doing quite a few of them in order to get the benefits. So we are kind of doing a range of, 15 to 30 before we retest. Because the challenge is that, you retest and I would say that this is definitely a challenge point, is that patients will, so the testing doesn't tell you what your body's overall amount of metals in your system. So we don't know how many. We just know that from that testing, how much your body is pulling out in that session. So the challenge is that you do a test and you have high amounts of metals, and then we do a series of, say 15 to 20 chelation IVs, and then we retest. And sometimes those metals are still showing up as high, and a patient will say, oh, well, that didn't work. And it's not that it didn't work, it's just that there's so many metals that we're pulling out that we're still pulling large amounts. So that can sometimes be the challenge of testing even after doing it. So I would say, like, no matter what, every time we're doing chelation, we're pulling metals out.
Yeah, and I think it's important to say that even if you do a test, a heavy metals test, and you have no metals coming out, that doesn't mean that you're metal free and you don't need a detox. That means your body can't excrete them.
And that's true too.
Yeah, it means your body can't excrete them, and that's not good. That means that you're accumulating, not excreting them. And when we get people started on a detox program or doing IV chelation, they're finally able to mobilize this stuff, and you start seeing it on tests. And so it's kind of almost the opposite of what people think.
That's sometimes exactly what happens, is that as we're working with patients, even their first test, they have high ones. And then their second test, sometimes their numbers are even higher. And they're like, oh my gosh, I've been doing all this work. And you're like, no, it means that your body's dumping, right? Dumping more. So yes, that's a very valid point, that sometimes even, I think that what you'd mentioned in terms of, even if we do the test and the numbers aren't high, that if it can be that you're just not detoxing very well, and you're a poor detoxifier, and you need to work on those organs of detoxification a lot better so that your body can effectively move those out.
So what are some of the most common metals that you're seeing with patients coming into your clinic?
So the most common ones would be lead, mercury, and aluminum. Those are the ones that tend to show up highest. In really, I'd say that's probably the general North American population. I think that it's always surprising, right, that people have those high amounts of mercury, because I usually blame it on those like metal amalgams in people's mouths. And to see that, even patients who've never had a mercury filling are still showing up with high amounts of mercury. And I think that, lead used to be in everything. So lead used to be in everything from the paints on our walls to, used to be in the gasoline. It used to be part of toys. And so it's not too uncommon that, and again, you're accumulating them over a lifetime. So it's not uncommon to see lead show up. And, aluminum, we get aluminum from aluminum cans, aluminum pots, even if if our water's going through aluminum piping. So yeah, it's actually surprising, but, I think that our soils are also quite contaminated. And so we actually, our foods end up being high in heavy metals, although they're not most of our foods aren't being tested for heavy metals. So it's hard for us to really know. But I think that as we, that's a major source of where those heavy metals are coming from is from our food sources.
Yeah, it's amazing. And that's one of the reasons why foods don't have metal labels on them, or, they did it for supplements, but I think that's, not terribly effective. I don't really believe in the Prop 65 myself. I think that's kind of a way for pharmaceutical companies to steer people away from natural supplements and foods. And the reality is, something with a Prop 65 warning on it, you get more lead in a cup of beans than you would in this supplement. So it's a little bit of a joke. So most high quality supplements, you don't really have to worry because you're getting more metals in your food, even if it's organic. Because organic food means pesticide and chemical free, doesn't mean metal free. And it's also, exactly. I had another comment, it's statistically impossible not to have lead. It's impossible not to have aluminum. Our medical director, Dr. Bruce Jones, did a statistical analysis of all his, thousands of patients that he's tested, and everyone had aluminum, everyone had lead. Almost everyone had mercury. Most people had cadmium and nickel. I mean, it's really, it's impossible to avoid these metals in our environment.
Yeah. And I think a valid point is that our bodies are meant to have zero heavy metals in our system, right? And so even though when we do the testing, there's like a normal range of what's acceptable, and then there's those high ranges, like really in terms of all of those metals and how our bodies function, we should have zero metals in our system. We don't need metals to function.
And that's a very good point, because a lot of people get these tests back, hair mineral analysis or urine or stool tests or blood tests or what have you. And they'll like, that's not in the toxic range, but it still can be causing problems. That small amount that you're excreting over that 24-hour period, or maybe a hair test, it's a 3-month period, that still can be very problematic. And where you see one rat, there's 1,000 more. There's probably more of that in your fat and your brain tissue and your bones and other tissues where that came from. That's just what your body is able to excrete.
Yeah.
So one thing in regards to IV chelation is that I think a lot of people think, I'm going to do a detox. They'll do like the 10 or 20 or 30 IV chelation sessions. And they think that they're done, that they've detoxed. But the reality is that, IV chelation can remove a lot of heavy metals, obviously, but there's still a lot of deeply embedded tissues that have built up over decades, and you're not going to be able to just do IV chelation ongoing for years. There's a certain point where you have to do other things and things we talk about here at Myers Detox in order to really get to the deeply embedded tissues, and it's an ongoing process. It's just not something that you're going to do a detox for a few months and you're done.
Yeah. Yeah. Well, I always talk about health as a process, right? That health isn't just a destination. And yeah, I think that one IV chelation is part of that process, and it's one of the tools that we use. But I think that you also have to think about, we always look at it like the body as like that holistic system, in that we also have to look at, cleaning up the diet and cleaning up those organs of detoxification, supporting them at a nutritional level, also at a deep cellular level, and making sure that toxic loads are moving out of our system, whether those toxic loads are more environmental toxins, whether they're heavy metals, whether they're coming from our foods. So you always have to be in a process of cleaning up your system. And one of the ways is to make sure that on an ongoing basis. So I'm not like a strong believer in that you just do like a detox for a short period of time. I think that if we can live a healthy life on an ongoing basis, that's going to have more of an effect on our systems than just doing a chelation therapy session.
Yeah, the work isn't done. You have to do some
Yeah,
stuff on
yeah,
your
exactly.
own.
Yeah, exactly. There's more to it for sure.
Yeah, and
Yeah.
what are some of the things that you recommend once a patient is home and they kind of done all their sessions of IV chelation? What are some of the things that you recommend?
So yeah, I'm a strong believer in that we need to be eating clean diets, that we need to be eating diets as much as possible that remove a lot of those toxic loads. I know it's not possible to do 100%, but as best we can, and making sure that we remove major inflammatory foods, from gluten to cow's dairy to refined sugar to those unhealthy oils and those vegetable oils. So those are the start. We want to also work on balancing out the microbiome. So putting the healthy bacteria back in and removing overgrowths of bacteria and fungus. I think that plays a big role. We need to be making sure that we improve organs of detoxification. So liver, kidneys, lymphatic system. To me, those are all part of making sure that we get the system functioning at optimal capacity.
Yes. Yeah. And another organ of detoxification is the
Yeah.
gallbladder. And
Yeah.
so just for anyone who doesn't know, what is kind of the gallbladder's role in detoxification?
Yeah, and even when I just listed those off, it's a much forgotten organ, but a very important organ. And the gallbladder, what it does is it releases bile, and bile helps to emulsify fats, and it helps to move healthy fats into the body, like including like your fats that are going to help to support really every cell membrane in our body and our neurological system in our brain. And it's going to help to move those fat soluble toxins into, fat soluble vitamins into our body. But the other role that the gallbladder plays is it helps to move fat soluble toxins out of the body. And heavy metals are a fat soluble toxin. So the gallbladder has to be working at really optimal capacity in order to effectively move those heavy metals or any other fat soluble toxins effectively out of the body. So the gallbladder definitely plays a big role in terms of heavy metal detox.
Yeah. And a lot of people are their gallbladder's not working that well. They're not producing enough bile, or they have gallstones, or there's a lot of women, especially in their 50s, have gallbladder issues, and usually they go to a conventional doctor, and the doctor's like, oh, just take it out. Let's just cut it out. So you won't be in
Yeah.
pain anymore. And that is just such a travesty to me, because you
Yeah.
need your gallbladder, and
Yeah.
it's very easy to reverse issues with the gallbladder, gallstones, things like that. So
Yeah.
what are some of these things that contribute to poor gallbladder function, and what can this lead to?
Yeah, so the things that can lead to poor gallbladder function is if we have an overload of fat soluble toxins. And what happens is that the gallbladder, that bile that's within that gallbladder should be like quite a fluid substance. So it should be a dynamic system. And what can happen is that when it gets really all gummed up with a lot of fat soluble toxins, then what can happen is that gallbladder just ends up being more like sludge than like a nice fluid. And when that's can definitely decrease the proper function of that bile flow and how that gallbladder is functioning well. Because what that gallbladder typically ideally wants to do is it's like a proper time release of bile into the digestive tract when we consume any sort of fats in our diet. But it won't be able to function optimally if that bile is more like gummed up and more like sludge. So those fat soluble toxins are definitely a contributing factor to that sluggish bile and sluggish gallbladder.
Yeah, and that leaves people vulnerable to developing little cholesterol balls that they can grow bigger and bigger and bigger and then turn into gallstones that cause attacks, gallbladder attacks and pain under your rib cage. And then, you go off to the doctor and like, let's get it out. Let's remove that. You don't need that gallbladder. What's wrong with that picture?
Yeah. And I think that's the challenge is that, people think that that's kind of your easy fix to any sort of gallbladder attacks or gallbladder pain is that, let's just remove this organ. But I think that what people really need to realize is how important that gallbladder is to how our bodies function, how we digest foods, and how we properly detoxify. And without that gallbladder, it does change your life. It's going to make it so that you can't have a lot of fats in one meal, that you would have to separate those fats throughout the diet, that you're probably not effectively absorbing your fat soluble vitamins. And, some of those fat soluble vitamins are A, D, E, and K, right? So we need all of those. We talk a lot about D right now in terms of getting proper sunshine, and we need that D in order to help boost our immune systems, and that especially women. We talk about bone health, but they need that K in order for us to make sure that the minerals that we're absorbing are going to the right places. So I think that we lose sight of the role that gallbladder plays. We think that it's just this holding place for bile, but it's playing such an important role in terms of how our system's detoxifying and how it's functioning and how it's absorbing fats, right? We need fats for every cell membrane in our body, right? And our body's made of cells. So the importance of that proper fat absorption, how our brains function, how our nervous system functions, we need fats. So I think that often we get confused and, people are still stuck in that mentality that eating fats will make you fat, right? And so why do I need proper fat absorption? And that's, the role that the gallbladder's playing in terms of being so important for detoxification.
Yeah. And I've heard of people getting their gallbladder out and they have chronic diarrhea for even up to a year after they've had it removed. I mean, it causes a lot of digestive problems for not everyone, but for certainly a number of people.
Yeah, because you haven't resolved the issue. Just by removing the organ doesn't solve the problem. I know I feel so bad because so many of my patients, they're having stomach problems and they've had their gallbladder removed, and the gallbladder being removed didn't resolve their stomach issues, right? So they're still suffering with stomach problems, and it wasn't, they were told that the gallbladder was the problem and that was kind of their magic solution, and it didn't resolve their problems because you weren't treating things at the root cause.
Yeah. I mean, I think people have to be really careful when they go to a conventional medical doctor and really looking at the person's skill set, because a conventional doctor is not going to be doing functional medical tests, figuring out what is the root cause of what's going on and how do we address that rather than, just addressing the symptoms with medications or surgery and just cutting out the gallbladder. And it's the same with the appendix. You need your appendix for digestion as well. And people just, oh, you don't need that. Let's just cut it out. And really doing a huge disservice to people. So I always say get a second opinion with a functional doctor, naturopathic doctor, anyone. Don't just rely on one person to make very major life-altering decisions like a surgery like that.
Yeah, I agree. Because you're told that, oh, it's a very minor surgery. It's in and out, right? There's very little. Yeah, it's very routine, and I think it's tough to see so many people losing that important organ.
Yeah, it's a routine, life-altering surgery, no problem.
Yeah.
Yeah, and so how can a person support their gallbladder function?
So there's lots of ways that we can support that gallbladder. One of the ways is through incorporating bitter foods into our diet. And I think bitter foods tends to be something that gets forgotten, right? We talk about sweet and salty foods, but we don't talk about bitter foods. Bitter foods can help with proper gallbladder function, and there's some bitter herbs that can be helpful for that. Fermented foods can also be helping with proper gallbladder function. And then there's basically, we usually do them as supplements, but you could do them as food sources too. But one of them is choline, which, you find in high amounts in egg yolks. And the choline helps to make the bile thinner and can help with better bile flow. So those are, just some ways that we can help to, some easy ways kind of that we can help to support the gallbladder.
And then there's coffee enemas, everyone's favorite protocol for detox. And I am a big fan of those to help thin out the bile and to help the liver function better, help the body detox better, and also but most importantly, helping to make more glutathione and get that, bile kind of thinned out and cleansed.
Yeah. I think that the benefit of those coffee enemas is that the rectum is so highly vascular, and so you absorb that coffee right into the bloodstream, and then you have direct access to the liver and the gallbladder through those portal veins. So yes, that's also an effective tool too.
Are you recommending those to your patients?
Yeah, so I have patients who ask me about them, and if they are willing to do them, I'm definitely supportive of them doing them. We don't do them in the office; they have to do them at home.
Yes.
So that's
you need to go home and do that in the privacy of your own bathroom. Yeah, and
yes, exactly.
Yeah, and that's what's great about coffee enemas too, is you can do it at home. You don't have to go pay someone. It's one of the most inexpensive and most effective detox protocols out there. So is there anything that we've left out of the conversation that you wanted to add in regards to detoxification or things that you like to do with your patients?
I think that we really covered it, because I think that the point that does often get forgotten when we talk about heavy metal toxicity is the important role of the gallbladder. So I'm glad you asked me about that, because I think that that's an important system that often gets forgotten in terms of detox, and especially in terms of heavy metal toxicity.
Okay, great. Yeah. So why don't you tell us where we can find you, learn more about you? If anyone listening wants to work with you, how can they get in touch with you?
Yeah, so the best place to find me is through my website, which is advancednaturopathic.com. And then in social media, probably the place I hang out the most would be on Instagram. And my handle there is Dr. Melina Roberts.
Okay, fantastic.
So those are best places to find me. Yeah.
And where is your practice located?
And we are in Calgary, Alberta, Canada. So basically on the west coast of Canada. Yeah.
Okay, fantastic. Fantastic. Well, Dr. Roberts, thank you so much for coming on the show. Very much appreciate your input because I've gotten so many questions about IV chelation and, when to do it, should I do it, what have you. So thank you for answering all of our questions.
Yeah. Thank you so much for having me, Wendy. It's been wonderful.
Yeah, and everyone, thanks so much for tuning in to the Myers Detox podcast, where we talk every week about different topics related to heavy metal detoxification. Get all your questions answered. So thanks for tuning in. You can find me on YouTube, youtube.com/Wendy Myers. You can also find me on Facebook, Instagram, all the social media at Myers Detox. Thanks for tuning in, and I'll talk to you guys next week.
The Myers Detox podcast is created and hosted by Wendy Myers. This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. This podcast, including Wendy Myers and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.